Good evening, and thank you all for joining us for another installment of our Ask the Doctor series. I'm Titania Bailey, president of Arc of Knowledge, Inc., a nonprofit organization that provides resources towards building and strengthening relationships between our youth and seniors. And as a part of our generational health and well-being initiative, we have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. Of course, before I introduce our speaker, just a few quick reminders to keep your devices muted throughout the presentation, and all questions can be entered into the chat and will be addressed at the end of the session during the Q&A portion. Our speaker for today's Ask the Doctor session is Dr. Kimberly Benson. Dr. Benson has been with MedStar Health for 2 years. She served as the clinical lead at MedStar St. Mary's Hospital, then transitioned to the clinical coordinator for the rehabilitation medicine department at MedStar Southern Maryland Hospital. Dr. Benson holds a doctorate of physical therapy and is a board certified neurological clinical specialist. Prior to embarking on her career with MedStar Health, Dr. Benson completed a postdoctoral polytrauma and traumatic brain injury rehabilitation research fellowship at Washington, D.C. VA Medical Center. Throughout her career, she has worked in a variety of settings to include a large university hospital, military hospitals, acute rehabilitation hospitals, and outpatient facilities. Dr. Benson is passionate about using data to drive quality patient outcomes. She is highly engaged with MedStar Southern Maryland Hospital Center's leadership to support efforts and promote patient mobility. Please welcome Dr. Kimberly Benson.
Thank you very much for that introduction. It's an honor and a pleasure to be here tonight to speak with everybody. This September happens to be Fall Prevention Awareness Month, so I'm very excited to be able to share some of my information with everybody. I'm going to go ahead and share my screen. All right, hopefully everybody can see that. All right, so once again, I'm Kimberly Benson. I'm a physical therapist at MedStar Southern Maryland Hospital, and it's an honor to be here tonight. So just some things I would love to touch on tonight is really looking at why are falls happening, identifying risk factors for falling, discussing key prevention measures, and then what are some suggestions if you are to fall, what can we do? And then I'm happy to answer any questions anybody has. So why do falls happen? So just to give you some statistics, 30% of elderly people are falling at least once per year. So falls do happen. And one third of adults over 65, they're falling each year. However, 20 to 30% of those people who fall suffer moderate to severe injuries. So that definitely leads to very challenging outcomes for a lot of people. So falls happen, but we want to make sure that we're avoiding moderate to severe injuries if at all possible. So just some facts. 15% of falls that happen are completely unavoidable. So no matter what age you are, it could happen to anybody. You have 15% of falls that have a single event that leads up to it. So you passed out, you had a stroke, you tripped and fell. Like there was this very specific event that happened. So that's 15% there. And then the remainder 70 are actually due to interactions between risk factors. And so some of the common risk factors that we find are strength deficits, balance deficits, mobility deficits, medication errors, mismanagement, or polypharmacy, vision impairments, cognitive impairments, depression, and effects of multiple comorbidities. So 15%, we're going to say, can happen to anybody. what we really want to focus on is this 70%, and what can we be doing within this 70% of falls to help prevent them and set us up for the best chance of success. So really looking at your risk factors is very important. So as a physical therapist, I'm of course going to say balance and strength play a big part of it, but it's really looking at the whole picture. So really looking at what is your environment like? Do you have a clear path within your house? Is there throw rugs? Is there, obstacles? I think of my parents who are in their 80s and live in a 100-year-old farmhouse. And, there's lots of obstacles that some I can modify, some I can't. So really looking around your home, your vision. So to really maintain our balance, we use 3 primary systems. So our vision, our vestibular, and our somatosensory. So vision is obviously what we see. Vestibular is, where we are in relationship within our inner ear, where we are in relationship to gravity and acceleration. And then somatosensory is kind of your joints and your body's awareness of where it is in space. So it's all those factors working together. So vision, it becomes a very important part of maintaining our upright stability. So medications can play a huge part of if when you sit up, are you getting, dizzy? Are they counteracting each other? Are they causing your blood pressures to be too low? So there's lots of things that medication can play a factor into. So looking at your chronic health conditions, nutrition and hydration. Dehydration can easily lead to people feeling dizzy and put you at higher risk for falling. So footwear and foot care. So really what you're standing on does matter. So just, paying attention to wearing closed-toe shoes, ones that are, fitted for you is really important. Cognitive changes, depression, and dizziness are also other factors that can really impact, put you at higher risk for falling. So we do have some common assessments that we can do just to see if where we're at in regards to our risk for falling. So one test that we use is the timed up and go. So what this is looking at how fast you can get up from a chair, walk 3 meters at a comfortable and safe pace, turn around, walk back, and sit down in the chair. So there's norms. What we consider would be 10 seconds or less. So adults should be able to do that in 10 seconds or less. If you start to hit 13.5 seconds or longer, it may be an indicator that you're at a risk for fall. So with these tests, we look at multiple tests kind of together to see what kind of factors do you have going into setting you up for a risk for falling. We have a 4-stage balance test. So this is looking at your balance in 4 different positions. And ideally, you would be able to hold each of these positions for 10 seconds. So the positions will obviously get a little bit harder as you go along. So position 1 would be standing with your feet side by side. Position 2 would be moving one foot kind of halfway in front of the other foot. So your insteps are touching the big toe of your other foot. Position number 3 would be moving one foot fully in front of the other. And then the position 4 would be standing on one foot. So if you can't hold positions 2 or 3 for 10 seconds, so if you can't kind of have that half stride or that one foot in front of the other for 10 seconds, or you can't stand on one leg for 5 seconds without losing your balance, it may mean that you're at higher risk for falling. And then the other test that we have is a 30-second chair stand. So what this is looking at how many times can you sit up or stand up from a chair without using your arms in 30 seconds. So we say you would put your arms across your chest and work on standing up from the chair and sitting down as many times as you can in 30 seconds. And then below that, you can see that I have norms for both men and women in different age brackets. So for example, a 65-year-old female should be able to do 15 sit-to-stands within 30 seconds. So the combination of all these tests can really kind of help paint the picture as to what is your overall strength and your balance, and knowing that those are large risk factors for falling. So now, how do we prevent falls? So there's lots of things to look at around your house. And then also, speaking with your providers can really help prevent falls. So first of all, making sure that you talk to your healthcare provider about medication side effects. A lot of medications can make you feel dizzy. So it's really important to know kind of what medications, could be causing what effects. Also, vision is a very important part of balance. And so making your home safer by using night lights or installing grab bars. So really having a bright environment can help with what you see around your house. Making sure you take time. So every time I go to work with a patient, I'm always saying, it's going from lying down to sitting, sitting to standing, standing to walking. You never want to go from lying down to walking, because that's often when you get about 3 feet from the bed or the chair, and then when everything kind of goes south. So really kind of taking your time and breaking down the changes in positions can be very important to help everything balance out and that you're not at greater risk for falling. Of course, strength and balance exercises are a great thing to add into your daily routine, and making sure that you get your vision and hearing checked regularly. And then also using assistive devices. So a cane or a walker. Oftentimes as a therapist, I'll hear people like to furniture surf, which I don't usually recommend that. I usually recommend, using your prescribed assistive device that can really keep you safer. So whether it's a cane, a walker, rollator, or anything, you want to make sure that it is fitted for you appropriately is another, very important caveat of that. Oh, let's see. So once again, these are just some more examples. There's lots of resources out there to, kind of have checks and balances with. So really looking at how your house is set up. Do you have grab bars by your stairs, within your bathroom? And making sure that you're removing clutter, using non-skid slip mats in your bathroom or any sort of slippery surfaces. So it could be in your kitchen, your bathroom. And making items accessible, lighting, your footwear choices, and then of course irregular exercise, and making sure that you're reviewing your medications and getting your vision checked. So there's lots of different things to consider when you're looking at how to prevent falls. So then definitely have mentioned some of these, but really creating a safe environment at home is very important. And prevention is, I feel, a key to success. So really removing your trip hazards. So looking around like throw rugs, cords, or clutter on the floor to the best of your ability, trying to remove those. Making sure you have safe paths for moving around, having bright lights. My rehab director is an occupational therapist, so I have to definitely send her a shout out for putting a plug into like, how are you doing your bathing and your dressing. So making sure that if you need to, make sure you're sitting down to get dressed, and so or whether it's in a bed or in a chair. Making sure that you have a shower chair and a grab bar, so that you can safely get in and out of the bathroom. Make sure you clean up your spills right away so we don't go back and trip on those. And then keeping frequently used items at waist and shoulder heights, just so you're not having to ever get on a ladder. I would highly avoid getting on ladders, and then doing a lot of bending down and standing back up, which can also be put you at risk for falling. So just really setting your environment up so that you're able to kind of access what you need most frequently at safe heights. So if unfortunately you do fall, there are things that you can do to make sure that you minimize the impact of that fall. So I wanted to share a video, hopefully it'll work, of just how do we get up after we do fall. So it can happen. And so we just want to make sure that we know how to get up from it and practice it. So if the situation ever comes, that you have to get up off the ground, that you're able to. So I'll just share this little video real quick.
I'm going to show you how to get down to the floor, back up again safely. In the event of a fall, this may be helpful. You need to familiarise yourself with movement towards the floor. You can build this up slowly. When you feel comfortable to do so, you can make your way towards the floor and down. Should you have a fall, you need to place yourself on your back and compose yourself. When you feel ready, bend one knee, then the other, and gently roll yourself to your side. Press yourself up to a seated position and either drag yourself or come up onto your hands and knees.
Oh, sorry.
And make your way to a stable piece of furniture. Steady yourself and rise slowly. And then sit down. And tell your doctor you've had a fall.
So that's just a quick little demonstration of how to get on and off the ground. Definitely practicing it before it ever happens. The other kind of key things that I would recommend is if you are ever alone, to make sure that you have a phone close by, or there are life alerts or anything that can also trigger people to know that you had fallen and can get you help. Now with our cell phones often are very close by. A lot of times you can even talk to them and then ask them to call for help for you too. But just really kind of taking that time to assess yourself. If you are injured, by all means, please don't, go ahead and push to get up. Take that moment to really assess yourself, and then only proceed to get up if you feel like you can. So after a fall, of course, you want to speak with your physician, but you also is a good time to, I think, to see a physical therapist. And so the one thing a physical therapist can do for you is really kind of focus on a individualized plan of strengthening, balance, and gait training. So how are you moving? What is your strength like? And are you able to maintain your balance? The therapist can also help kind of progress and make sure that you are using the appropriate assistive devices if you need, and really help you kind of minimize some of these factors that can contribute to falling. So I wanted to include, I would highly recommend going to a physical therapist and get a consultation so you can have your own specific individualized plans. But these are some, if I had to pick a few exercises that I would really recommend anybody to do, as long as they're not painful, of course, but could really help you with your strength and balance. So I have a quick little clips of some of these. So the first one would be sit to stands. So this one is just simply getting...
To start, sit toward the edge of the chair with arm rests. Place your feet hip-width apart on the floor and your hands on the arm rests. Stand up from the chair, using your hands to help as needed. Let go of the chair and pause when you are standing upright. Reach back for the arm rests as you start to lower down.
So this is a great exercise that really targets a lot of your lower extremity muscles, and then you can make it harder or easier if you use your arms or not. Heel rises would be another one.
Stand near a stable surface for support with your feet hip-width apart. Keep your knees straight and lift your heels to rise up onto your toes. Avoid leaning forward. Then slowly lower your heels back to the ground. Reach for support if you lose your balance.
So just really working on kind of narrowing your base of support and making it wider. Always having something there just in case. When I would work with patients who would lose their balance often too, I would say, you know, you can always do these in a corner. So if you're to ever fall back, you're falling kind of into the protected corner. So your back is to the corner is always another really great place to do any sort of exercises for balance.
Stand near a stable surface.
Sorry. So then some other exercises to really work on improving balance. I have a single leg stance.
This is how to get into the best position for this exercise. Stand close to a stable surface, like a table or a counter, for support. Place your hand on the surface to get into position and stand tall. Lift one heel behind you. And once you feel stable, try letting go of the surface while maintaining your balance. Then, repeat with the opposite leg. Remember, if you lose your balance, reach for support. Let's get started.
And then another one that I would highly recommend is walking backwards or just working on changing directions. When you walk into the bathroom, you may have to take a few steps back to get in and out of the shower, in and out of the bathtub, to close the door behind you. And so a lot of times we find going forward much easier than having to step backwards. So just practice backwards walking is another key exercise I would recommend for everybody.
For this exercise, you should stand in a hallway or near a counter for support. Make sure you have a clear path to walk before you start. Slowly walk backwards, trying not to look down. Try to keep your feet hip-width apart. Reach for the support if you lose your balance.
So there's just kind of 4 targeted exercises that can really help overall strength and balance.
This is how to get into the best position.
Sorry. So I also wanted to highlight there's a lot of great fall prevention resources available for everybody. So MedStar Health has their own fall prevention at home page that you can visit on their websites. The National Council of Aging has tons of information and even exercises. There's the National Institutes on Aging, which has preventing falls at home, room by room. The CDC has, a whole page for older adult fall prevention. I think one of the things I was most impressed with there is they have a booklet on mobility plans. So, it walks through some of what would happen if you were to lose your mobility and what things you can do to maintain your mobility. So I would highly recommend everybody, look and see what's out there and see what would work best for you. So I have to share my own fall hazards that I have. So I just want to say thank you to everybody, and I'm happy to answer questions. And then just to give you a map, so, I work at the hospital, but we do have many clinics throughout the area that we can service. So if you find yourself needing a physical therapist, would highly recommend reaching out. Let me see.
I was trying to unmute. Thank you, Dr. Benson, for that presentation. Are you able to see some of the questions in the chat, or would you like me to just read them off and you can respond to those?
And let me see if I can find
I
that.
can do it. It's fine. It's fine. When asked, does one need a referral to get a physical therapist?
So But I don't know exactly if Maryland is a direct access state. Some states are, Maryland, Virginia can be direct access. So you can go to your physical therapist for the initial evaluation, but then yes, you would need a referral, usually from your primary care physician, to make sure that insurance pays for it.
Could you please explain the difference between an occupational therapist and a physical therapist?
Absolutely. So that's another great question. So I feel like physical therapists are really focused on the movement science. So like, how are you moving, your quality of movement, looking at strength and balance. Whereas an occupational therapist looks at really, what do you do to occupy your time, is kind of how I explain. So what really interests you, and helps you really get back to those functional tasks that are important to you. So they are geared more towards activities of daily living, so bathing, dressing, showering. It could be IADLs like driving, shopping, and a lot of your cognition work as well. So they really look at kind of that holistic approach to really getting you back to what adds quality of life to you.
Can you provide some reasons that you may need a physical therapist?
Absolutely. I can name 100. No, I think physical therapists are really good, once again, at really looking at movement. And so they can help you create exercise programs that will prolong your mobility, help decrease pain, work on balance and safety with movement. People will go to a physical therapist for different sorts of pain. So back pain, a lot of times patients will go to a therapist prior to surgeries to see if getting the muscles in balance again can help prevent some surgeries. So there's lots of good reasons.
If someone falls and dislocates their elbow, would it be wise to also check and treat their shoulder?
Yes, I would say you would definitely want to see kind of what happened, and then yes, if your elbow is stuck or dislocated, then you would see what's happening down at the wrist, kind of the joint above and below. So looking at your wrist and wrist and hand, and then your shoulder as well. So yes, you would want to making sure that whole arm gets checked out.
Can you provide some examples of exercises for someone who experiences vertigo?
So there can be many different reasons why somebody has vertigo. So that would be definitely one reason I would recommend therapists. There's you can have specialized training in how exercises to reduce vertigo. So one of the exercises is seeing how your eyes and head are working together. So sometimes we have blurring of vision and changes in our acuity when we're focusing on things. So just even being able to focus on a point and then keep our eyes focused on it as we move our head side to side. So that's what we call a VOR exercise. Some of the balance exercises that I actually share, or the balance test that I shared. So standing with your feet apart, your feet together, kind of that one foot in front of the other. The reason that that's really important is it uses your kind of brain to listen to that vestibular system. So because you're taking away your other systems. So really to maintain our balance, we use the three different systems together. We use our vision, vestibular, and somatosensory. So if you make it more challenging, if you take away your vision and take away your somatosensory, so your kind of body's awareness of where it is, it really uses that system to use. So just kind of practice use of that. But definitely making sure they understand why you're having vertigo. There can be different reasons. It could be something like we have crystals within our ear that can create us to have kind of that spinning sensation. That can be done, fixed with a repositioning technique. Or we could have, there's certain antibiotics that, could actually damage the overall system. And so then you would have kind of a different approach. So you really do want that individualized care for it.
How can you rate the quality or competence of a specific therapist?
That's a great question. So I don't know if I have a great answer to that. I would say, what I think a big part of getting better and working with a therapist is the rapport that you have with them. So I think really building a relationship, and a big part of that relationship is trust, and making sure that you are progressing, that you have confidence in what they're asking you to do. And you should be seeing progress. If you're not seeing progress, it is always within your right to ask to be seen by another therapist, whether you do it within the same office, or go to somewhere else.
Is there a normal range? I'm guessing this means time frame for a person to see a physical therapist before, you just kind of, I guess, I'm sorry, I'm just trying to read this off, that it's either not working or that it's enough.
Yeah. So we use a lot of objective measures, meaning that we'll see what you're doing when you come in. So looking at, we have special tests that we use. We take measurements of your strength and your balance. And then we continue to assess that and make sure that you are progressing. So it's hard to say what a typical time frame is, based on diagnosis. So I have worked with some patients who have BPPV, and it was 1 or 2 sessions before they were, back to what they considered their baseline. And then I've had other patients that it's 6 weeks or so that you're working on progressing exercises. So it really can vary, but you do want to make sure that you're seeing objective improvement in whatever goals that you're working on, whether that's strength, balance, gait speed, could be, the range of motion, so several different things.
Okay, so getting back to the elbow dislocation, it says actually happened to me, but the physical therapist never checked the shoulder, didn't realize that I had issues with it until I started playing sports and working out. Should I revisit a physical therapist?
Yeah, so I do think if you're having an issue with a joint, it's never a bad idea to go back. You can always go through your physician just to make sure that you have your structure is intact. So looking at X-rays or MRIs just to make sure that everything is intact, and then yes, revisiting to make sure that you can really work on your strengthening, range of motion, and tolerance to that joint. So yeah, I would recommend following up with it.
Are there physical therapists for animals?
Absolutely. So a little caveat for me is when I was actually in school, I worked at a vet office doing physical therapy with animals. So I did a lot of the same things. I used the modalities. I had an underwater treadmill, so I did a lot of gait training with them. I would use TheraBand to do exercises with them, put them on the physio balls. So yeah, so definitely an exciting field.
Can physical therapists help with back pain even though there wasn't a real injury?
Yeah. So oftentimes there's multiple reasons why you may have back pain, whether it's an alignment issue, whether it's a muscle imbalance, whether it's posture related. There could be a herniated disc. So there's many reasons that can create back pain. So going to physical therapy is usually your first line of defense to really looking at your overall assessment of your mobility, your strength, and motion. And so going through therapy can really help kind of with that muscle balance. So having your core, so your abdominal muscles counteract and help protect your back. So really kind of setting you up for success. And then also looking at movement. So there's, different techniques that we can teach to help kind of protect our back, make sure that we're lifting correctly, make sure that we're getting in and out of bed without bending or twisting. That can put a lot of strain through your back. So kind of learning some of the tips and tricks to actually protect your back can also be very helpful.
I'm sorry, let me read this off. I had what I believed was plantar fasciitis, and it actually turned out to be something in my back that the physical therapist was able to diagnose. How is it possible that the doctor missed that?
Yeah. So I think we all have our specialties. For just a little bit of my background, I went to school for 7 years to learn about how do do movement assessments and really looking at people's, assessing their quality of motion. So we all have our specialties and look at kind of the picture a little bit different. So, without knowing the specifics of the case, it's very easy, if something doesn't show up on imaging, they may say that you're fine, but then yes, it's having that person who understands the quality of motion to kind of put things together and really kind of hone in on where some of the pain could be coming from.
What exercises do you recommend for intense sports athletes to prevent future injuries in their shoulders and joints?
Well, that's a good question. I don't know if I have anything right off the top of my head, but I think doing things I would incorporate your core and your upper trunk. So planks are always a good thing. So being on your hands and knees and really looking at that kind of stability around your joint. I'm trying to think, I don't know if I really have specifics, but I would just look at your range of motion and the strength within the joints and then around those joints.
Are there any exercises we can start doing at earlier stages in life to retain knee mobility and reduce pain down the line?
Yeah. So specific exercises. So squatting, you'll see a lot of as a and then doing that to kind of tailor to your tolerance is it a good thing. It's maintaining kind of the balance in your muscles between your quadriceps, so the front muscles, to the back, to the hamstrings, what's in the back of your leg. So just maintaining your balance between your muscles. So sit to stands, squats are always a great thing to kind of look at. Walking, to maintain your activity level is always a great activity. I'm trying to think of other things that, and then you're doing bridges to look at your glutes too. So any kind of muscles that are around your knees and support your knees, and just to make sure that you're maintaining strength in those muscles is kind of what I would recommend.
Can you tell us what happens in a typical physical therapy appointment?
Yeah, so I think it would probably vary depending on why you're there. And so typically you would start off with an evaluation. And so, getting all your measurements and then really kind of understanding your objectives for being there would be where you would start. And then, in the outpatient setting, following up with that, typically it's a combination of manual therapy. And then you could be using equipment, so using exercise equipment, and then having specific exercises to target your wherever whatever you're working on.
Let's see, the other one is, when should you see a physical therapist versus a chiropractor? They also put orthopedic doctor as well.
Yeah. So I would say that you can kind of use those all together. So the orthopedic doctor can kind of order a lot of the imaging and kind of get you that start of, really figuring out what you're dealing with. The chiropractors are really good at alignment. So to make sure that you're, you have proper alignment. And then a physical therapist, I would say their strength is really looking at kind of the balance of your muscles. So what might be pulling on your bones that could be causing some of the discomfort, and making sure that you have that balance within different groups of muscles to make sure that you're maintaining kind of the proper range of motion in that around that joint. So I think they can all work hand in hand. I think orthopedic surgeons are, if you are afraid that you completely tore, broke, or need surgery, that's always a good place, obviously, to go. But a lot of times we work very closely with them. And so they'll typically will start with physical therapy, and then chiropractors as well. So chiropractors are often, I feel like they're great for alignment, but not necessarily always that exercise component to make sure you maintain that alignment as well.
Can you give us some examples of when you should seek out a physical therapist, even if you're not hurt?
Depending on what you have going on, and what your goals are, can be reasons to see a physical therapist. So, I can take my father, for example. He fell and broke his hip a year ago, and he just finished up with outpatient physical therapy, I think a month ago or so. So, he no longer had that immediate injury, but they were continuing to progress him with his balance, with his strength, and that overall kind of adding mobility and quality of life back to him. And then we're going into the winter, he's stopping for the winter, but then to really get him back onto a good exercise regimen and really kind of work on his balance and strength again, I would recommend that he goes back to therapy to have that individualized plan of how to kind of be in the best shape you can for with whatever is going on.
Should you seek out a physical therapist when you are starting a new workout routine?
Yeah. And so, I do think that a lot of times we had, I can say that I have often worked inside the hospital. So higher level sports is definitely not my expertise. And that's kind of the neat thing with physical therapy, is that we're across many different settings with many different specialties. So, I have a friend who works exclusively with elite athletes. And so, they are there to, do a lot of prevention. And so, there can be, maybe I lost my train of thought there, but let me see if I can go back and read that question.
There was one that was sent directly. It was more about reaching out to a physical therapist when you begin a workout regimen.
Yeah. So I think they can definitely make sure that you are doing the motions correctly. So with a new workout too, we want to make sure that we're in correct postures and making sure that we are not putting ourselves at risk for injury. There's definitely lots of tricks on how to bend, lift, twist, pick up, push, pull, all that sort of stuff. And so having somebody really look at your quality of movement can be very beneficial for the prevention of injuries in the future.
And the last question that I have, I don't know if any of our other people have any questions, was I was recommended to seek out a physical therapist prior to starting a new job where it was physically demanding. Is that normal?
Yeah, and I absolutely, I think the prevention is key. So a physical therapist can really kind of assess your quality of motion and really give you some kind of tips and tricks of how to keep your body safe, especially as you add higher demands and heavier loads to it. So, that can absolutely, be, we have therapists who work in factories, who, work with patient or work with people, ergonomics and just really looking at how do you keep yourself safe when you have different either repetitive motions or, loads. So that could absolutely be normal.
Okay. All right, does anyone else have any questions they'd like to ask Dr. Benson?
Well, thank you very much. It was a pleasure meeting with you all.
Thank you, Dr. Benson, for that insightful presentation on fall reduction, balance, and strength training exercises. We hope that all of you found this presentation helpful. And as always, a big thank you to our MedStart team for your collaboration on this important initiative. And thank all of you for joining us. The information in the chat shows where we will have this information available. Dr. Benson, can you also put your information in the chat in case anybody wants to reach out to you, make appointments, or have any other questions that they need answered?
What is Arch of Knowledge?
Arc of Knowledge is our organization that partners with MedStar Health.
Is it a physical therapy group or just a lot of programs?
So we provide the programs and the resources for the community.
Thank you.
And feel free to look at our website, and you can see some of the other things that we offer as well. Okay, so we hope that you will also join us next month for another installment of our Ask a Doctor series, where we will ask the breast surgeon. So thank you all and enjoy your evening.
Thank you.